Let's talk about 4 strategies to avoid these common mistakes when caring for pediatric patients. Pediatric patients are at a higher risk of medical error because of lack of medical research in standard dosing, rapidly changing body weights, the need for medication compounding, and because their communication is limited at this age. Dosing weight errors in non-adult patients typically occur because of discrepancies in the reported weight, particularly the conversion from pounds to kilograms. All drug dosing references will be reported per kilogram. A typical scenario is a patient being weighed on a scale that results as pounds or the caregiver reporting the weight as pounds, but it is transcribed into the chart as kilograms. 1 kilogram equals 2.2 pounds. So if a child presents with an actual weight as 7.5 pounds, but it is entered as 7.5 kilograms, it will actually be dosed at 16.5 pounds. That is more than double the actual patient weight, which would be more than double the calculated dose. To avoid this, we need to have a reasonable expectation of weight based on age. What does the average newborn look like versus a 1-year-old, a 4-year-old, or a 10-year-old? Have a general idea of the weight for pediatric patients at landmark ages. If the age and expected weight gap varies significantly, it is worth investigating and verifying prior to dosing. What to do in pediatric emergencies? The inherent risk in pediatric healthcare is only amplified in emergency situations. We minimize the risk of dosing errors by using the Brazlow tape. The Brazlow tape is a color-coded tape that is placed along the length of a child to determine their color zone. Each zone represents an estimate of their weight and length with corresponding pre-calculated doses and equipment sizes that would be most appropriate. The Brazlow tape reduces the need for frantic calculations in pediatric emergencies. The third strategy is a pediatric double check. As the name implies, all pediatric calculations and medication compounding should be independently checked by at least 2 practitioners. The independence must be emphasized. It is not a double check of your calculations. Do not show them your work, do not share your thought process or final answer prior to their independent calculations. They are performing their own calculations without the influence of anyone else. The fourth strategy is inspection of units per day versus per dose calculations. Penicillin is an example of a drug where the dosing is provided as per day and per dose in the same drug reference, depending on indication. Be mindful of this and always double-check the units of the recommended dose. Access the full article, 4 strategies to avoid mistakes in pediatric patients, at pharmacology.com.